It's time for Medical Monday on Wisconsin Tonight. Dr. Courtney Anderson from Baycare Clinic is here with me now talking about dental implants and who is best suited to get them. So before we get to that, what exactly is a dental implant?
Well, a dental implant's probably the best dental invention since the toothbrush.
Okay,
it's the
great.
best way to predictably and successfully restore a missing tooth or missing teeth.
Okay, and who is a good candidate to get dental implants?
It means patient to patient. Almost anybody could be evaluated for an implant. Really, the only patient classification or case selection that's not a candidate would be someone who's like a pediatric patient.
Because they're still growing.
Correct. You want to wait till they're about 17 or 18 years of age before the implant's placed.
Now, whenever we start talking about things in the mouth, people are worried about pain. Is this a procedure that's really painful?
For people who've had a filling, it's pretty comparable to that because it's just usually done under local anesthesia. There's very little stimulation involved with the procedure, so there's very little discomfort, and then you can return to activities usually that day or the next day.
Now, dental implants can be a single tooth or it can be multiple teeth. And how long does the procedure about take?
Well, if it's a single implant in a very kind of straightforward position, it can be placed in 30 minutes, roughly. Some of the more complicated procedures can take a little bit longer.
Okay, and also people are wondering, if I get this done, if I go through this and get the tooth, how long is it going to last? Do I have to do this again in the future?
Well, when you compare bridges, which are kind of the conventional treatment for replacing a missing tooth, that lasts on average for 7 to 10 years.
Wow, okay.
Whereas an implant lasts 35 to 40 years and beyond.
Okay, and this is something in the mouth regarding your teeth. Is this something that's usually covered by insurance?
We're seeing more and more insurance companies covering it because they're kind of realizing the value of it and how long-term it lasts.
Okay, and there's a couple ways that you can kind of figure out if you're a good person to be up for dental implants. Do you want to kind of explain that self-test?
Well, the big thing is, are you missing a tooth or teeth? Obviously, if you're not missing one, this is not a procedure that you would do. And then if you have problems potentially wearing dentures, that's another good use for implants, is it prevents the tipping and rocking of the implant or the denture.
And you brought some little props here to kind of explain
did.
what the procedure exactly, a little more about it, because they're actually replacing the root of the tooth.
Correct. So for one tooth, you can see there's a little titanium post that goes into the jawbone. So my job is to replace the root of the tooth, and then your dentist puts a component into that implant, and then the crown can go on it.
So it really can improve somebody's smile a lot, where they
Correct.
didn't have a tooth before. They can really have a nice pearly white in that place.
And then for dentures, it's nice because, you know, a lot of times dentures kind of flop all around, whereas if we put 2 implants into the lower jaw, the denture just snaps in and then it doesn't go anywhere.
All right, great. A lot of good ways to help people out for looking for a dental implant. So if you're looking for more information on those implants, you can contact Baycare Clinic, and we have a link on our website, NBC26.com.